Well, welcome back again. Well, we'll continue with our trial on safety of Metoprolol XL in hypertensive with COPD. Well, the objective of this trial was to evaluate efficacy, safety, and tolerability of chirally pure S-metoprolol succinate extended release tablet in the treatment of hypertension coexisting with COPD. Open label, non-comparative, prospective, 50 patients with coexisting diabetes mellitus. Well, S-metoprolol 50 milligrams was given to these patients, and the hospital in which they were enrolled was Inlac and Budhrani Hospital in Pune. Blood pressure, heart rate, respiratory symptoms, and adverse reactions were assessed at every visit. Period of study was 60 days with follow-up of every 15 days. Well, the conclusion, chirally pure and cardioselective S-metoprolol is safe, effective in the treatment of hypertension in patients suffering from COPD. This was an article which was published in Indian Medical Gazette in the year 2006. Now we'll talk about the mind maps of Smart COPD. Well, it was to evaluate the objective. This is in the mind map form, which about the same study which we have spoken about. It was to evaluate the efficacy, safety, and tolerability of chirally pure S-metoprolol succinate 50 milligrams in the treatment of hypertension coexisting with COPD. This was an open label, non-comparative prospective study where blood pressure, heart rate, respiratory rate, adverse reactions, and spirometry were done. 50 patients were enrolled for 60 days and they were having dyspnea, cough, or dizziness. Blood pressure on day 0 or the baseline and the heart rate on day 0 was measured. It was 160/96 and heart rate 83 beats per minute respectively. Well, over the period of days, on day 15 it was measured. The blood pressure 150. On day 15 there was a drop of 13 stroke 7 and heart rate dropped by 3. Then on day 30th there was a drop of 22/17 and heart rate there was a drop of 6, whereas on day 60th, that is after 2 months of the therapy, there was a drop of 30/20 millimeters in systolic and diastolic blood pressures and heart rate reduced by 9 beats per minute. Well, the baseline was 160/96 as you can see, and after 2 months of therapy the blood pressures came down to 132/76. Well, forced expiratory volume and the ratio did not change on day 30th. Well, conclusion drawn was chirally pure and cardioselective S-metoprolol is safe, effective in the treatment of hypertension in patients suffering from COPD. So to conclude this, there was no increase in the dose of bronchodilators in 40 patients who were on these medications even before initiating S-metoprolol. There were 31 patients with a history of smoking who responded equally to S-metoprolol therapy as non-smokers. There was no significant change in FEV1 and the ratio of FEV1 to FVC on day 30th. Also, clinical findings did not reveal any worsening of pulmonary functions compared to baseline findings. There was no symptom based on event-based exacerbation of COPD in any of the patients. Thus, it is evident that S-metoprolol therapy was safe and well tolerated by all the patients with chronic obstructive pulmonary disease, that is COPD. Now we go on to the Smartsealer Trial. Well, the objective of this trial was to assess the comparative efficacy and safety of fixed dose combination of S-metoprolol 25 milligrams plus S-amlodipine 2.5 milligrams versus FDC of amlodipine 5 milligrams and racemate metoprolol 50 milligrams and FDC of amlodipine 5 milligrams and etanol 50 milligrams in the treatment of hypertensive patients with angina. So there were 3 arms, 107 patients were enrolled. As you can see, 53 in the chirally pure group, that is S-metoprolol 25 and S-amlodipine 2.5, 30 patients with etanol and amlodipine, and 24 patients in metoprolol 50 and amlodipine 5. Blood pressure, heart rate, and angina episodes were recorded on 14, 28, and 56 days respectively. Well, the period of study was 56 days. Conclusion: the fixed dose combination tablet of S-amlodipine 2.5, metoprolol 25 is effective and well tolerated in reducing blood pressures and angina episodes in hypertensive patients with history of angina pectoris with or without coexisting diabetes and or hypolipidemia. So this was an article which was a study which was published in Cardiology Today in the month of July August in 2008, and this endorses that fixed dose combination of S-amlodipine with S-metoprolol is effective and well tolerated in patients with high blood pressures who may or may not have angina episodes or coexisting diabetes or hyperlipidemia. This is the list of all the trials which have been conducted on the Indian population and the publications. All the sample size is approximately to 3,000 patients. So these are the details. Well, you can go through the 10 trials which are there or the studies which have been conducted on the Indian population. So with this